Good afternoon, everyone. Welcome to this press conference. I am joined by the Chief Medical Officer for Bermuda, Dr. Sean Remroot. And I stand before you today to remind our community of a vital opportunity, and this is an opportunity to directly influence the future of health in Bermuda. The Steps to a Well Bermuda survey launched last year and is still underway. This internationally recognized survey, carried out in partnership with the Pan American Health Organization, gathers critical information about the health and lifestyles of the people in Bermuda. It helps us to track the real-world factors that influence our risk of chronic conditions like diabetes, high blood pressure, and cancer. Why is this important? Because what gets measured gets managed. Up-to-date data strengthens the evidence base that we rely on to guide effective, responsive health policy. But with your participation, we can take strategic, informed steps to do the following. 1, improve access to care. 2, support healthier nutrition and physical activity programs. 3, reduce tobacco and alcohol-related harm. And 4, develop responsive policies that meet your actual needs. And if you are selected, we encourage you to please say yes. Participation is entirely voluntary and confidential, but it is also extremely powerful. When someone knocks on your door and invites you to take part, know that this is more than just a survey. It's a chance to be a part of a health movement. It includes a health questionnaire, a simple physical measurements like blood pressure and height, and an optional finger stick test to check blood sugar and cholesterol. Each person who participates becomes part of a healthier future for Bermuda. Bermuda, we cannot do this without you. This survey has been carefully and scientifically designed to ensure that the health of all who call Bermuda home is represented. If you've been selected, please know that your participation adds valuable information to a clearer picture of Bermuda's health. And as someone you know has been selected, I urge you to encourage them to take part. Let's be clear. The decisions that we make today about how we fund health care, how we prevent illness, and how we care for one another depend on the quality of the data that we gather now. Your participation isn't just helpful, it's essential. Together, through shared responsibility and cooperation, we can ensure that this critical health information shapes a healthier future for every Bermudian. Thank you.
Good afternoon, everyone. As Bermuda's Chief Medical Officer, I'd like to offer a few words about why the Steps to a Well Bermuda survey is such a critical part of our public health efforts and why your participation matters. STEPS is not just a survey. It is one of the most robust and is an internationally recognized tool for collecting public health data. It allows us to better understand the behaviors, the risks, and the trends that influence chronic diseases in Bermuda. The data we will gather will shape how we prevent illness, promote wellness, and plan for future care needs. Since the survey launched last year, we've completed just under 400 interviews. That's well below our original target. And while the progress has been slower than hoped, each completed interview represents a meaningful contribution to Bermuda's long-term health outcomes. We know there have been challenges, both for participants and for interviewers in the field. Some people are hesitant to engage. Others are unsure as to why they were selected or how their data will be used. These are understandable concerns. That's why we are renewing our public outreach and reinforcing our commitment to confidentiality, professionalism, and respect at every step. If you are selected, please know, 1, your participation is confidential. 2, your data will be used only for public health planning. And 3, and most importantly, your time is deeply appreciated. We are also inviting former and new interviewers to join and rejoin this effort. Your work, approaching households, earning trust, collecting data, is what makes this all possible. Many participants have told us they learned something new about their health after being interviewed. This information can be a powerful first step forward for anyone to prevent disease or start early care. And many of our interviewers have also shared how rewarding it is to connect with people, share information, and be a part of something that truly matters for Bermuda. Together, we can ensure that all the decisions made about prevention, funding, and clinical care are grounded in real-life data, and that every step we take is a step toward better health for a well Bermuda. Thank you.
Questions from the media, and we'll start with Bermuda Broadcasting.
Good afternoon, Minister. Good afternoon, Dr. Ramroop, and thank you. So I'm listening to your, you said you've conducted 400 interviews, and it's been about a year since this was launched. The first Steps to a Well Bermuda survey took place 2014. That had nearly 1,200 participants, so we're around a third of what was there. And I know that it was stated a year ago that you wanted 2,500 participants or households had been selected. What's the problem? Is this obviously it was a different government at the time in 2014, but whatever data you have from then and what you're dealing with now, what has changed? And does it have anything to do with what we've been through since then, going through the pandemic? Are people a little more resistant to giving information?
Yes, so there are a number of factors. What we found, there is a bit of hesitancy, and this may be affected by the recently concluded pandemic. Also, what studies have shown in places that have tried to conduct STEP surveys before is that sometimes there's a little bit of exhaustion on the part of the public. They've been through a number of surveys and everything else that they've been through, and we're trying to address those. So hence the reason we call this press conference today, to try to assure the public that, one, they can have confidence in the process. The process is reproducible, it's statistically significant, and it's been utilized all over the world. The Cayman Islands just finished theirs. However, what has been happening worldwide is that people have been having difficulty completing these surveys. So hence the reason we're here today, to try to reconnect and to give some reassurance to the public that we are really, really trying to finish this, and it's very, very, very important, and it's going to be useful in the long run.
Okay, just to double check, is it only Bermudians participating or all
it's
residents?
Anybody, any resident.
All residents. And you said it's a global issue. It's getting participation, or at least in some. Yes. It's happening in some other places, but that, let's face it, 400 interviews in 1 year. That's a very low number. Apart from this press conferences, realistically, what's the chances of getting that full?
Right. So
2,500.
Right. So without getting into too much as to why we ended up with that particular number of participants, the survey will be determined to be significant and have significant findings statistically if we have more than 1,550 participants. Okay. 2,600 is desirable. The bare minimum is 1,550. Okay. So we're not that far away.
1,550.
Yeah.
400 to 1,550.
We're not that far away. We think we can get there in the time frame that's allowed to complete the survey.
Okay, and obviously we had results of the 2014 survey, and it cited common non-communicable disease risk factors of poor dietary habits, physical inactivity, and overweight and obesity as being all too common in our population. Realistically, with this survey, are we expecting to find anything has changed?
Well, that's a good question. So the thing is, it will be more than 10 years' time, and it kind of gives you a measure of what has happened in that 10 years. We can all postulate, but until then, we don't know until we actually have the results. Because what it does, it extrapolates for age, sex, financial income, behaviors, habits. There are a lot of complex statistical tools, especially in a small population, 65,000 odd. you're going to be able to really dig down and find those groups most at risk. So in a general sense, maybe we may not find anything generally different from what we had. And this is just me saying maybe to answer your question. I don't know. However, we will be able to drill down and find those groups most at risk and probably from that point in time make policies to address this to those groups. So that's the real reason we do it, to drill down.
The other question, I'm sure this will be something of note, actions taken since 2014. Can you cite some of those that have been, the government has taken, or the two different governments have taken since 2014 to address what was brought up then? And
I want to take that one.
Okay.
Yeah.
Yeah. Thank you, Gary. Like you said, that was in 2014, and a number of in the absence of having the data in front of me, but I recognize that there were a number of matters that were raised as it relates specifically to things such as obesity. And you'll note that through the Department of Health, we do have the department that the section actually that helps to do health promotion, and through that there's been a number of activities that we've been engaged in to try to encourage persons to eat healthy, exercise, all of the things that one would expect to do to be able to circumvent and address those issues that came up. So through the health promotions department, we are actively engaged in health promotion activities and awareness campaigns and so forth.
okay. A notable question that I'm sure some in the community will wonder about is when you complete this survey and you get the data, if the actions taken between 2014 and now have not significantly impacted Bermuda's underlying health problems, will that demonstrate that some of the actions taken by government, including the sugar tax, must be reconsidered?
I think it's a little bit early to say, and we'll look at that once the data comes in, but I think it's also important to note that the two consecutive omnibus surveys that were conducted in Bermuda showed that there is a decrease in consumption, in adult consumption of sugary soft drinks. So we have seen an impact. Whether or not it's as huge as some people would like, the reality is we have seen an impact, and as the CMO will probably be able to elaborate on more, sometimes it takes a generation before you see the actual impact, positive impact of public health measures, such as the implementation of a sugar tax.
Okay. Moving so we can get your comment. Obviously, you released a statement yesterday on the COVID cases increase. It's not like it was where we get the numbers in the same way and we get the age ranges, but where is the significant risk in COVID now compared to where it was obviously 2 or 3 years ago?
Okay, I will yield to the CMO on that to
Yeah.
provide you some more detail.
Okay, so in terms of the COVID risk, what we have been seeing is there has been an increase in the number of COVID cases that's been reported to the surveillance unit. But those they have not reached the level for our population to suggest as a red flag so far. But it has been flagged. We are monitoring it. And if we look at past trends, even after the worst part of the pandemic, they mirror what we expect around this time and what's been happening on both sides of the Atlantic in terms of the number of cases. So what we've done in the Office of the CMO, we've sent down some samples to see what is the predominant strain that we have here. And in a general sense, we're usually a couple of weeks behind what's happening in the US and the UK, but it's not unexpected, but there is an increased level of vigilance in my office regarding that. And we will be putting out public statements as are required. So I hope that answers your question.
Yeah.
Cool.
Thank you, Dr.
Thank you.
Ramroop.
Thank you.
Thank you.
Thank you, Gary. We now take questions from the Royal Gazette.
Good afternoon, Minister. Good afternoon, CMO. Thank you for having us. First question, this is actually mostly just regarding COVID. So we were curious, when did the Ministry of Health first notice that these numbers were reaching levels of, again, you mentioned that they weren't red flags, but at least levels of concern? And what is the range of that? So what were the levels before we started noticing this upward trend, and what are they currently at?
Okay, so first of all, before I talk about the trend, it all depends on how much testing people are doing, right? So what we get are confirmed results. So what we have found is that the amount of in the past 3 weeks, I can't remember specifically, I don't have the data in front of me, over the past 3 or 4 epidemiological weeks, what we have found is that the number of cases we would have gotten in 3 to 4 weeks are now happening in 1 to 2 weeks. So, and when we look at the trends, when my epi unit has looked at the trends, is what we expect for this time of the year when there's an increased amount of travel, increased awareness, people being reminded by the Department of Health Travel Clinic that they should be looking out for signs and symptoms of COVID. So people are becoming more aware. It's not necessarily that there's maybe more COVID, but maybe there's more awareness and more testing. But we are keeping an eye on it.
I see. So we don't have exact numbers of how many people
Sorry,
have
for the purposes of this today, I didn't work with the exact numbers.
I see.
But we can share that later on.
Okay, please, thank you. Secondly, this is regarding the updated vaccines that are available. We understand that that these vaccines are available at the Hamilton Health Center, but are those only available at the Hamilton Health Center, or are they available at other health departments, or really everywhere?
So these vaccines that we have, specifically, they are against the JN1 variant, and they are available, as you said, at the Hamilton Health Center. In addition, they've been made available through doctors' offices, private doctors' offices, for persons who may be eligible to get them, and they are still available. And I'd like to encourage the public and the general practitioners, if you have clients who meet the criteria to benefit from these, to please avail yourselves of them. They are still available.
I see. I also understand that these were. Actually, no, I'm sorry, you didn't answer that. That is really everything I have. Thank you.
Thank you.
Thank you. Thank you, Dr. Ramroop. Thank you, Minister. Do you have anything you'd like to say before we end?
No, just thank you everyone for your attention. And again, we'd just certainly like to encourage members of the public, if your name is called, to participate in the STEP survey. It is for the betterment of all of Bermuda, so do your part and say yes. Thank you.
Thank you. Thank you both, and that concludes today's press conference.